Alex, how can I assist you?
What are the normal range of blood pressure and what do they mean?
The normal range for blood pressure is typically around 120 over 80 mmHg. The first number, systolic, measures the pressure in your arteries when your heart beats, while the second number, diastolic, measures the pressure when your heart rests between beats. Normal, less than 120 over 80 mmHg elevated. 120-129 systolic and less than 80 diastolic hypertension stage 1. 130-139 systolic or 80-89 diastolic hypertension stage 2. 140 or higher systolic or 90 or higher diastolic hypertensive crisis, higher than 180 systolic and or higher than 120 diastolic. This requires immediate medical attention. Keeping track of your blood pressure is essential for maintaining heart health. Have you had your blood pressure checked recently, or are you considering monitoring it more closely?
Uh, I will. And what are the most common cause of high blood pressure?
The most common causes of high blood pressure, hypertension include 1. Obesity, excess weight can increase blood pressure. 2. Lack of physical activity, sedentary lifestyles can contribute to weight gain and high blood pressure. 3. Unhealthy diet, high salt, fat, and sugar intake can raise blood pressure. 4. Smoking, tobacco use can damage blood vessels and raise blood pressure. 5. Excessive alcohol intake, drinking too much alcohol can increase blood pressure. 6. Stress, chronic stress may contribute to high blood pressure. 7. Genetics, family history can play a role in your risk of developing hypertension. 8. Age, blood pressure tends to rise with age. 9. Chronic kidney disease, this condition can affect blood pressure regulation. Managing these factors can help keep your blood pressure in check. Are there any specific lifestyle changes you're considering to help with this?
What are the treatment of hypertension?
Treatment for hypertension often involves a combination of lifestyle changes and medications. Here are some common approaches. 1. Lifestyle changes, healthy diet. Adopt a balanced diet, like the DASH diet, which emphasizes fruits, vegetables, whole grains, and low-fat dairy. Regular exercise, aim for at least 150 minutes of moderate aerobic activity each week. Weight management, losing even a small amount of weight can help reduce blood pressure. Limit alcohol, drink in moderation. Quit smoking, this can improve overall heart health. Reduce stress, incorporate stress-reducing techniques like yoga, meditation, or deep breathing exercises. 2. Medications, if lifestyle changes aren't enough, doctors may prescribe medications, which can include diuretics, help remove excess sodium and water from the body. ACE inhibitors, relax blood vessels by preventing the formation of a hormone that narrows them. Calcium channel blockers, relax blood vessels and reduce heart rate. Beta blockers, decrease heart rate and cardiac output. Angiotensin II receptor blockers, ARBs, help relax blood vessels. It's important to work closely with a healthcare provider to determine the best treatment plan for you. Have you discussed your options with a doctor yet?
No. Tell me about what are the risks of having low blood pressure?
Low blood pressure, hypertension, can also pose risks, and some common concerns include 1. Dizziness and fainting. Low blood pressure can lead to insufficient blood flow to the brain, causing dizziness or fainting, especially when standing up quickly. 2. Fatigue. Chronic low blood pressure can result in fatigue and a general feeling of weakness. 3. Nausea. Some people may experience nausea or feelings of lightheadedness. 4. Shock. In severe cases, extremely low blood pressure can lead to shock, which is a life-threatening condition that requires immediate medical attention. Symptoms include confusion, cold and clammy skin, rapid breathing, and a weak pulse. 5. Inadequate blood flow to organs. Low blood pressure can prevent vital organs from getting enough blood and oxygen, potentially leading to organ damage. While low blood pressure isn't usually a cause for concern, it's important to understand its effects. If you're experiencing symptoms, it's a good idea to consult a healthcare professional. Have you noticed any symptoms that worry you?
No. Tell me about what are the risks of having a high blood pressure?
High blood pressure, hypertension, can lead to several serious health risks, including 1. Heart disease. It increases the risk of heart attack, heart failure, and other cardiovascular diseases due to the extra strain on the heart. 2. Stroke. Hypertension can cause blood vessels in the brain to burst or become blocked, leading to a stroke. 3. Kidney damage. High blood pressure can damage the blood vessels in the kidneys, reducing their ability to filter waste from the blood effectively. 4. Vision loss. Hypertensive retinopathy can occur when high blood pressure damages the blood vessels in the eyes, leading to vision problems or even blindness. 5. Aneurysm. Increased blood pressure can cause blood vessels to weaken and bulge, leading to an aneurysm, which can be life-threatening if it ruptures. 6. Metabolic syndrome. This is a cluster of conditions that includes high blood pressure, high blood sugar, excess body fat around the waist, and abnormal cholesterol levels, increasing the risk of heart disease and diabetes. 7. Cognitive decline. Hypertension can affect cognitive function and increase the risk of dementia over time. Managing blood pressure is crucial to reducing these risks. Have you had a chance to check your blood pressure recently, or are you looking for ways to manage it?
Okay, thank you. Bye.
Goodbye. Hope to see you again.